MRI for stroke. Here we will discuss about the most basic sequences of MRI for detection of the ischemic stroke. So which one is the most important sequence that I want to look into for detection of the stroke? That is the diffusion weighted image. On the diffusion weighted images, the ischemic area appears bright. And the best part is that these changes occur within few minutes after the occlusion of the vessel. Along with the diffusion weighted image, I will like to look into the ADC map. On the ADC map, the low ADC values will be registered as loss of signal and the area will appear dark. This is known as restriction of diffusion. After the diffusion weighted image, the next most important sequence is the T2 weighted image. On the T2 weighted images, again the ischemic area will appear bright. However, this takes some time to develop, about 6 hours. On the flare images also, the same bright signal will be seen as on T2 weighted images. Finally, the changes will be seen in the T1 weighted images. On T1 weighted images, the ischemic area appears dark. There is loss of signal. However, this takes some more time, about 24 hours, to show some change. Similarly, the post-contrast images also will show contrast enhancement during this time. Regarding contrast enhancement, it appears about in 3 days. It peaks in about 3 weeks. And it disappears by 3 months. This may be called as rule of 3 of the contrast enhancement. So in the early hyperacute stage, the most important sequence is the diffusion weighted images and the ADC map where the changes will be seen. This is followed by the T2 and flare images where the changes will be seen in the late hyperacute stage. And finally, the T1 weighted images and the post-contrast T1 weighted images will also show changes in the acute stage. The swelling and mass effect sets in the acute stage. Later on, the swelling and mass effect gradually gets reduced during the subacute stage. And the ADC values start increasing so that the areas that were dark on the ADC map will again become bright. The ischemic area turns into loss of brain tissue and encephalomalacia and gliosis sets in about 3 weeks, when it is known as the chronic infarct. Thank you.